Hi everyone, welcome to Dermabites with Dr. Viv. I'm Dr. Vivian Okuta. Today we'll be talking about a very interesting topic, stretch marks. I'm sure most of us know what these are. Now, stretch marks tend to develop when there's an increase in what we call the glucocorticoid hormones circulating in the bloodstream. Now, glucocorticoid hormones are produced in the adrenal glands, are commonly increased in pregnancy and also in adolescence where you have a growth spurt. Then we see the increase in obesity as well, and in bodybuilders. We've also seen that there's an increase in the stretch mark development in people who lose weight rapidly or gain weight rapidly. So these are situations where you can find stretch marks developing. Now, we have other conditions where stretch marks may develop, like in individuals who are on steroid medication. People who take steroid medication could also develop stretch marks. And then those who are prescribed topical steroids, like the creams, the steroid creams. But you know what? A lot of people abuse these topical corticosteroids and use them for the purpose of bleaching. And what you find is that the skin thins out and they develop stretch marks on parts of body that you should never see stretch marks, like the face. I've seen quite a number of people with damaged skin, thinned out skin, where you can see the network of blood vessels and you see stretch marks all over the body, from head to toe, including on the face. And I mean, that's really unfortunate. So it is important for you to know that steroids are actually medication and should not be abused as such. Now, you know that the skin has the protective outer layer, which is your epidermis, and then below the epidermis we have the dermis, and it's in the dermis we have fibroblasts. Fibroblasts produce the supporting collagen and elastin, and these fibers are what are responsible for giving our skin its strength. So when you have the circulation of these hormones, the corticosteroids, the glucocorticoids in particular, then the fibroblastic activity is non-existent, and that is why the skin tends to break down. So it's important for you to be very careful when it comes to any of these situations we've talked about. In pregnancy, for instance, usually it's about the 6th to 7th month that stretch marks start to develop. Some women are lucky and they don't develop stretch marks at all. Like I was lucky in both my pregnancies, I didn't develop any stretch marks, and I'm grateful for that. But there are a lot of women who have developed stretch marks, and some men, because I had said bodybuilding, etc., could be a cause or a reason why men have developed some stretch marks. The good thing is that there's some treatments out there available for your stretch marks. In clinic, we offer laser therapy. We also offer what we call microneedling, and in some spas, etc., they offer microdermabrasion. And what these do, they tend to stimulate fibroblastic activity to build more support so that the stretch marks will essentially vanish when you have that solid support. Now, I hope you've learned something here, and if you need help when it comes to stretch marks, because treating them could be an uphill task, there's some creams out there which are quite effective, but they take a long time, so patience is key. But you know what? Time flies. So if you want to start now, maybe within a year, you see remarkable improvement in your stretch marks. Well, I hope you learned a lot here, and I look forward to seeing you again soon. Thanks for listening.